I don't like to stand between you and lunch and golf, so I've been asked to go through this at a high level very quickly. But what I want to do is explain to you what an effective wellness program can do to help you, one, identify your risks within your population, and then what do you do about those risks to help you reduce your costs overall. So I am Chris McMillin. I'm with Unity Point. I'm the director of the managed care and the PHO and wellness departments within Unity Point. Optimum Health is a worksite wellness company, and we are owned by Unity Point. We work with many different employers. The size doesn't matter. We have very small employers that have 10 or less employees, and we have employers that have thousands of employees. So wellness really works across the spectrum. In addition to that, it doesn't matter what funding mechanism you have for your health plan. So how many people in the room, how many have fully insured health plans? Okay, the majority then are self-funded. So regardless of the funding mechanism, wellness does work for both types of health plans. In addition to that, there are some varied services that we can provide based on your funding mechanism, but it can fit very nicely within both. In addition to that, even though we're owned by Unity Point, we do work with groups with various different network affiliations, whether you utilize Unity Point, whether you utilize OSF, whether you utilize a large national carrier like Cigna or one of the wrap carriers with your TPA. It doesn't matter your network affiliation, we can work with all types of groups. So before we start, just a couple key statistics. Why is wellness important? Obviously, we believe that you and your employees within your organization are your greatest asset. And if you think about a couple national stats, chronic disease is the leading cause of death and disability in the United States. Of that, 133 million Americans, which is about 45% of the population, has at least one chronic disease. If you talk to our medical director and look at the stats from the government websites, they will tell you that on average, 70% of all chronic diseases are preventable. That's a big number, and it's all based on our lifestyle choices. What we eat, if we get any exercise, our weight, our smoking status, our weight status, things like that. Looking at those type of risk factors has a direct impact on lots of things. It has an impact on your healthcare costs, on your absenteeism, on your presenteeism, on your work comp, your disability, and obviously just on the quality of life overall. So what we've done is put together a comprehensive package of how do we identify those risks, and then what do we do about those risks. So the way our product works, it's in a bundled package. It starts off with a health risk assessment, and that's that online questionnaire that many of you may have filled out before, and it's asking questions relative to what you eat and your sleeping habits and your exercise habits and that type of thing. And health risk assessment is also really important because it also drills down into the scientific ability to tell what is that person's stage of change. Are they a pre-contemplator? Are they a contemplator? Are they in an action stage? Because then when they're working with our health coaches, if we know what stage they're at as far as their contemplation, then we know what to talk to them about to get them to make better choices. The health risk assessment, after you get done completing that online, there's a button, you push that button, and then you schedule your on-site screenings. All of our screenings happen at your locations based on your shifts. The screenings require a 12-hour fast. Most of our employer groups do a full blood draw. We do have a finger stick option available, but most of our groups figure if they're going to go through this process, they want to give as much data to the individual as possible to look at their risk factors. So we go through a full blood draw. In addition to that, you move on to the next station during the screening, and you have several different biometric measurements that we take. And those include your height, your weight, your blood pressure, your heart rate, your waist circumference, those type of things. It takes your members, your employees, about 15 minutes to get through the process from the time they walk in the door until the time they leave. Everything's by appointment so that we be very mindful of the productivity of your staff as well. After we look at the health risk assessment and we look at the screening data, what we need to do then is deploy the most effective intervention strategies to look at that risk and decrease that risk. Health coaching on a one-on-one basis with your members is the most effective intervention strategy that you can deploy. A health coach is when we risk stratify your group, we look at your members in two different ways. We utilize the data. If you're fully insured, we only utilize the data from the health screening and the HRA. And there's a lot of data there. If you're self-funded, We also work with your third-party administrator, and we get an upload of your medical and prescription claims every single month. And we do that because we put it through a predictive modeling tool, and we're looking for these types of things. What are the gaps in preventive screening compliance? What are gaps in care that we have? In addition to that, we identify members that are trending upwards for cost in that predictive modeling tool. We do this in two ways because you could have people that screen and have just absolutely awful results and have lots of risk factors that have never had a claim. Those are kind of your ticking time bombs out there. On the flip side of that, you could have people who have had lots and lots of claims, but their screening results look really good. And that's because they're taking blood pressure medication or they're taking cholesterol medication, that type of thing. So their screening results do look fairly good. So if you're self-funded, by being able to couple that information together, we can really get a really good look at your individuals and what their risk factors are. The coaching program is all done by motivational interviewing techniques. It doesn't do any good for me to look at you and say, you can't drink soda, you need to drink more water, you need to stop eating cookies at 10 o'clock at night. Nobody's going to listen to you. Nobody's going to make a change based on that type of a regimen. They need to talk to the individual and meet them where they're at. What are the roadblocks in that person's life precluding them from making better decisions? We have a very large client in Peoria, PDC, so it's that picks up all our garbage in our county. One of the things that we heard from every single one of our drivers is, I'm not packing my lunch, McDonald's is on my route, that's the only place I'm gonna go, I'm not changing what I eat for lunch, we're gonna have to figure out something else. So our health coaches gathered up from all the fast food restaurants, all the different menus, and talked to the drivers about, okay, you're gonna go through McDonald's, but let's make a couple better choices. Maybe we don't supersize the fries. Maybe we switch out water 2 days a week rather than a large soda. So it's those small, manageable changes over time that make a difference in the risk factors. The predictive modeling tool, one of the reasons I want to expand on this just a little bit is the predictive modeling tool predicts clinical events and associated costs for each one of your members based upon their claims data and their risk factors that we identified during the screenings. That's important because if you're a self-funded plan, it also helps you manage that plan with your TPA. And Terry can talk about that a little bit further, I'm sure. In addition, we look at the national standards of compliance for 20 different chronic diseases. So let's take diabetes, for instance. If we have a member that we know is a diabetic, when we open up their record, there's a checklist there, and the 10 things that a diabetic needs to do to be compliant with their disease, an A1C, an eye exam, a foot exam, that type of thing, we can see whether or not they've had those items. It's not our job to tell them what they need to do medically, but as a coach, we will say to them, we see you haven't had your A1C. We see you haven't had your eye exam. You really need to get back into your physician, talk to your physician to see if they think it's appropriate for you to have that testing done. Because as we know, a diabetic who's non-compliant ends up with lots of complications potentially, with a lot of associated costs. So it's all about managing those risks. So here's what we do. We take that information from the screening. If we have claim data, we take that information too, and we do a risk stratification of your population. We put them into 3 different buckets: low risk, rising risk, and high risk. And usually you'll see the percentages. In most groups, 60 to 80% are at low risk, somewhere between 15 to 35% are at rising risk, and then somewhere at the end of that is the individuals that are at high risk. Now I will tell you, this is national standards. However, we have screened groups that our highest one that had 73% of their population at high risk. That's a huge number. Today, by the way, they are down to 22% of their population at high risk after multiple years in a health wellness program. So what we do with those individuals is put them in that tier and then decide what services do they need in order to help them reduce their risks. The people in the low risk category, usually 0 to 1 risk factors, a coach is only going to talk to them 2 times a year. The first time is right after the screening. We're going to go through their results, make sure they understand their risk factors, and set a couple goals with them, and then check in 6 months later. If you're in the rising risk, which means you typically have somewhere between 2 to 3 risk factors, you're going to get touched 4 times a year. And again, first time after the screening and 3 more times during the year. If you're in that high risk bucket, we are going to touch you 10 times a year, which is usually once a month following the screening process. We take that a step further. Our coaches are not nurses because they're there to do lifestyle coaching. So they're registered dietitians, they may be exercise specialists, health educators, that type of thing. But those people that are in the high risk bucket, we risk stratify them further, and then we determine if they need to talk to a care coordinator, which is a nurse. If it is a person that has lots of comorbidities, if it's a person that goes to the ER all the time, if it's a person that has lots of admissions, or maybe they just have a ton of specialists that they deal with, it's better to have a nurse deal with those individuals to help them quarterback their care for them and help them coordinate everything that they're doing with their different physicians. Obviously, reporting is extremely important. If you're going to spend the money on a wellness program and invest in your population to try to reduce that risk, how do you monitor that? We have a very, very robust reporting package, and this package allows us to give you as the employer aggregate data so we can tell you what your population looks like. We give reporting to the individuals so that they can see what their risk factors are. And then during the year, we give you a whole host of reports that will show you any progress that we're making as well as cost associated with that progress. We have a saying in our office that you cannot change what you do not measure. So we want to show you what your potential return on investment is and then monitor that throughout the year as well. I would encourage you, that's about as fast as I can do that overview of that program. I would encourage you to take a look at what you're doing today. Whether you work with Unity Point or you work with some other vendor, looking at the health of your population is important. Your individuals spend an exorbitant amount of time at the workforce every single day. If they're working on their health, a lot of our employer groups will allow the spouses to come in and work and participate in the wellness program too, because they're at risk for those spouses on the health plan. I would encourage you to engage in that type of program. The fees associated with a wellness program, if you're self-funded, we attach a CPT code to it and we send it to your TPA just like a claim. So as we go through the process and as you look at different type of strategies to risk stratify your group and to look at your overall risk, think about that statistic that we talked about in the beginning, that 70% of chronic diseases are preventable. If you get your arms around chronic disease, you can do a lot to reduce your risk factors and associated cost in many other categories. That's it. That's as quick as I can go. Thank you for your time. Now, Terry Streebing is going to kind of plug this all together from the TPA aspect in paying claims and wellness as it relates. Oh, are you going to want this?